What many people miss about IBS and digestion in general is just how complex the digestive tract is. And when we think about IBS and the digestive process, we think the digestive tract as a inanimate tube. It's not alive. It's just sitting there in the middle of your abdomen and it's not doing anything. That is until things start going wrong. Then you start thinking, must be something I'm eating. Maybe it's stress. But this too takes a pretty limited view on the actual depth and complexity of this very vibrant and sensitive organ. Yes, it's responding to the food, but there's much more to it than that. My name is Dr. Terranella, and this channel is dedicated to helping you understand and optimize your health. Today, we're talking about what many people miss with IBS, and that is just the complexity of the digestive tract and IBS in general. If you're liking these videos and getting a lot out of these, please hit the like and subscribe button to continue getting videos like this. All right, let's jump into the video. So as I said, what many people don't get about IBS and digestion in general is that a healthy digestive tract requires a healthy immune, neurological, endocrine, and healthy other systems in your body in order to function and work the way it's supposed to. And this complexity is often overlooked, if not de-emphasized, by the level of inquiry or depth of inquiry that's typically done in a conventional GI medicine setting. That's not to say that they don't understand this complexity, but more so the practice of medicine in a GI setting de-emphasizes this complexity. And many of you have experienced this firsthand. For example, beyond the typical colonoscopy, endoscopy, few tests are done in the GI setting, yet there are many tests available that can give us clues about what's going on. And this limited testing leads people to believe that their digestive tract is simply inanimate tube, and that if the tube itself is healthy and nothing else is going on there, that the whole GI system itself must be healthy. And so nothing else can really be done, right? Well, obviously this is not the case, and that's a wrong approach to take. So what I want to do is share some of the complexity that's there in the layers of testing that you can do to reveal some of this deeper understanding and deeper nuance that's going on in your digestive tract. And so we're going to get into more specific examples to give you an appreciation of how complex this system is. A very common scenario that people find themselves in is that they have a digestive issue, a symptom that's occurring in their bodies, and they go and see a GI specialist. They then do a colonoscopy or endoscopy that shows that it's normal. Nothing is wrong there. Everything looks good. Then they may get a medication to take. So if they have constipation, they may get a laxative of some kind. And if they have diarrhea, they may get a medication that can help with the spasms and cramping of the digestive tract. But the diagnostic tool didn't tell us anything super useful in this case. So let's break this down a little bit. So you had a normal colonoscopy / endoscopy. What does that actually mean? Well, it means that the cosal layer, the soft membrane part of the tube lining your digestive tract, doesn't show any problems. There's not a lot of inflammation or damage occurring there. This is good to know and very good that that's not happening. But there are more layers than just the cosa to your digestive tract. There are more macro things, larger things that are important to look at. And there's also more microscopic things to consider when you're having IBS or ongoing digestive symptoms. And testing can help us understand this. And this is often what frustrates people because they intuitively know there's more there that could be going on and there's more that could be explored. So let's look at the micro level. So the colonoscopy and endoscopy are looking at the cells and tissues of the stomach, esophagus, small intestine, large intestine. But there are things that this test will miss too, such as disturbances in your microbiome. These tests don't look at microbial counts and microbes in general, except in the case of maybe H. pylori. So to say or assume that everything is normal, digestively speaking, is a bit misleading. In my experience, the microbiome disturbances are the bulk of what causes GI disturbance and GI problems. And yes, of course, there are mucosal problems that can occur too. But again, it's just looking at the limited side of the global picture of the digestive tract. So if you're experiencing ongoing digestive issues and have only been tested through colonoscopy or endoscopy, there's much more for you to explore. So let's look at a couple scenarios to illustrate this. So I've discussed post-infectious IBS in the past, and it is one of the most common causes of IBS, is often overlooked or not even considered. And symptoms usually start after some kind of food poisoning or even a upper respiratory tract infection also affects the intestines or the GI tract. A month later, after the infection, inflammation is persisting and the IBS-like symptoms such as alternating constipation or diarrhea, bloating, gas, etc. start to appear. And because it comes on maybe 1 or 2 months after the symptoms have subsided from the infection, normally people often miss that is related to the food poisoning or the upper respiratory tract infection. And the symptoms might not always be that extreme either. Instead of having major constipation or diarrhea, you might just have light increased discomfort, but it's certainly going to be a change from what things were prior. So the normal set point is shifted in one direction or the other, sometimes both, in terms of how frequently you're going and the ease at which you're going. The good news is there is a test that you can take to understand this more nuanced layer of your digestive tract, and it's called the IBS Smart Test. The test looks for ongoing inflammation and antibodies that are in the blood. So it's a blood test for 2 specific things. One is a bacterial antibody, so it's looking to see if there's ongoing problems from this bacteria there. And the other is an antibody to part of the digestive tract, the proteins that line the intestines. And that second one is going to go up when there's kind of an autoimmune process going on. Your immune cells are actually attacking parts of the intestinal lining that are supposed to be there. And that can create persistent problems with the nervous system in the digestive tract and also the ability of the digestive cells to have healthy mucosal lining. And this is the exact kind of complexity and nuance that I'm trying to get across here, that your digestive tract is not just an inanimate tube. There's a lot going on there in a depth that we're just now starting to understand. Okay, so before we jump into the macro level of things, I wanted to make sure you're aware of a couple helpful courses that I put together that may be useful if you're having ongoing digestive issues, IBS, etc. One is more on the diagnostics and understanding what to do when you might have something like post-infectious IBS going on. And the other is kind of a more global approach to digestive health in general. There'll be links in the description if you want to check those out. Okay, now let's zoom out and look at kind of the macro picture. So on the macro side, there's often things that are overlooked or not considered as well. And one of those is a lack of digestive capacity. You can have IBS symptoms resulting from consuming foods that your body can't actually break down well. Like a good example is lactose. If you're missing the lactase enzyme, you're typically going to experience diarrhea, bloating, maybe gas from the lactose containing foods. Remember though, all dairy has some lactose in it, but the longer that it's fermented, the less lactose is going to be present. So hard cheeses and things that are fermented for longer periods of time, like yogurt, you may not notice these effects, but it still could be having a minor effect on your digestion, just not as noticeable. And things like ice cream and milk itself are going to be more obvious of an issue. Histamine foods, the same is kind of true with this, because your body may lack the ability to break down that's naturally occurring in food. You may not have enough diamine oxidase, and sometimes this can lead to constipation or diarrhea. Certainly going to lead to more upset stomach, maybe nausea, even acid reflux. And so if you lack the DAO enzyme or diamine oxidase enzyme, the more histamine present in the food is going to cause more digestive issues. Another similar but different thing is the ability to break down your food in general, kind of more of a global ability to break down your food. This has more to do with breaking down the chemical bonds in between things like carbohydrates, fats, and proteins. Each of these macronutrients requires a different type of enzyme in order to break it down. And when it comes to carbohydrates, there's multiple enzymes that are necessary to do this. So these are things like lipases, proteases, amylases. And there are stool tests that can be done to identify if there's fat in your stool or suggesting of not enough fat absorption, which could be also from bile acid insufficiency as well. And there are tests you can do to identify if you're lacking DAO enzyme, lactase enzymes, and similar types of tests. And so these are just kind of 2 microscopic, macroscopic angles on this, but there are many other tests that you can do to expand your knowledge of what's going on with your digestive tract regarding things like inflammation, immune health, endocrine function. Things like bile acid excess or deficiency can often play a role in digestive health issues. And of course, there's a whole host of tests from pathogenic microbes to even commensal good microbes. These are all important aspects of our digestive system. It's not difficult to integrate and understand these things, but it certainly requires persistence and a little bit of critical thinking and curiosity to find answers to what's going on. Simplifying the issue to say that it's just a mucosal tissue issue is to not respect the depth of the organ's complexity. These other tests that I mentioned, of course, do have their limitations too. Some of them aren't necessarily FDA approved, and so it could require out-of-pocket expenses, but they can provide valuable information for you if you've been struggling with problems for a long period of time. Sometimes you can bring these tests up to your GI doctor and ask them to run them too, and they may actually be covered. So if you're suffering a couple $100 here and there, could be the difference between more suffering and actually getting some relief and resolution of what's been going on. Remember, a good treatment is only going to come after a good solid diagnosis, and that's what testing helps you do, is get firmer understanding of what's going on, the diagnostic aspect. So hopefully this video gives you a better, deeper understanding of IBS, some of the things that people tend to overlook or miss with IBS. If you do have questions about anything here, please drop it in the comments. That's why I do the videos, to help you guys understand what's going on. If you do want a more nuanced, detailed answer, consider joining the membership program, where I'll have more time and attention to dedicate to your question. One question you might have after watching this video is, what is post-infectious IBS and can it be cured? You can find more information on that video right here, and we'll see you next time.